Hello and welcome to Med4Care. I am Dr. Care and today's topic will be the Nocturia. Let's find out together what it is. Nocturia is an unpleasant urinary disorder, consisting in the need to get up one or more times during the night, with the urge to urinate. Nocturia is probably the most frequent LUTS. Lower urinary tract symptom affecting the global population and is often associated with serious and disabling parallel disorders such as sleep deprivation and the increased risk of falls during the night. Even those who wake up at least 3 times to urinate are subject to a significantly higher mortality risk than the general population. Most of the subjects suffering from nocturia and other concomitant urinary disorders report nocturia as the most bothersome alteration, that is annoying, compared to other conditions such as urination hesitation, terminal drip, etc. In fact, in addition to predisposing to easy fatigue during the day and a reduction in productivity, nocturia can also affect the health of the partner with whom you share a bed, as forced nocturnal awakenings are frequent. To be defined as such, nocturia must include a previous sleep period and a subsequent sleep period with respect to the time you get up to urinate, awakening being characteristic, which is due to the urge to empty the bladder. Antidiuretic hormone, ADH, also known as arginine vasopressin, is a hormone secreted directly by the hypothalamus, involved in the regulation of many body functions, including the control of blood pressure, blood volume and osmolality of body fluids. In particular, the hormone ADH plays a key role in the control of urine production, increasing the absorption of water at the level of the renal collecting ducts and therefore concentrating the urine in the bladder during the night. Although ADH is directly regulated by plasma osmolality, for example the concentration of dissolved ions in the serum, it may happen that gene defects in the gene that codes for ADH or an altered circadian rhythm can favor the imbalance of the hormone's action. Antidiuretic, thus leading to nocturia. To simplify, having to suddenly wake up from sleep feeling the strong urge to urinate can be attributed to the increased amount of fluids taken during the day or to the poor ability to retain urine in the bladder. In fact, taking in more fluids during the day results in an increased emission of urine to compensate for the homeostasis of liquids, while pathological bladder diseases of any type cause incontinence and a strong tendency to urge to urinate. Let's now see, in a more complete and systematic way, the causes that can lead to the genesis of nocturia. The most common cause of nocturia is represented by nocturnal polyuria, defined as nocturnal urinary production greater than 20% of the total in young people and greater than 33% of the total in the elderly. Nocturnal polyuria is usually associated with reduced urine production during the day and can be induced by excessive oral fluid intake in the evening, caffeine consumption and alcohol abuse. Pathological conditions such as congestive heart failure, obstructive sleep apnea and venous insufficiency can also lead to nocturnal polyuria. The second cause is represented by global polyuria. Another common cause of nocturia is defined as an overproduction of urine throughout the day, generally greater than 2,800 milliliters for a healthy person weighing 70 kilograms. Global polyuria always derives from a sharp increase in fluid intake, as in the case of those suffering from polydipsia, diabetes mellitus, hypercalcemia or nephrogenic diabetes. In patients suffering from nocturia not caused by polyuria, it is the problems inherent to the functionality and continence of the bladder that can come into play in the determination of nocturia. Various conditions can lead to an overactivity of the detrusor muscle of the bladder or to a reduced compliance of the bladder itself to the accumulation of urine, including neurogenic bladder, interstitial cystitis, intake of caffeine and alcohol, bladder cauterization, enlarged prostate, urinary stones, therapy with diuretic drugs. Insomnia, sleep apnea and OSAS, obstructive sleep apnea syndrome, i.e. the obstructive sleep apnea syndrome, can certainly contribute to the aggravation or direct induction of nocturia. In fact, it has been determined that nocturia occurs in 1 in 2 subjects with OSAS and, for this reason, it has been suggested that obstructive sleep apnea should be considered a diagnosis of nocturia, especially in younger male patients at the age of 50. When nocturia is secondary to chronic systemic conditions such as diabetes mellitus, specific symptoms of that condition may be observed concomitantly, such as, in the case of diabetes, polydipsia and polyphagia. If, on the other hand, there is a urinary tract infection, such as interstitial cystitis, it is common to find nonspecific signs of infection such as fever, malaise, and possible nausea and vomiting. In most cases, however, nocturia occurs in parallel with other typical urinary disorders, such as micturition hesitation, for example, difficulty starting urination, feeling of incomplete emptying of the bladder, hypovalid or intermittent flow, consisting of non-continuous, low-pressure urination polyuria, which is an increase in the frequency of urination, usually with low amounts of urine being emitted, urgency of urination, with an imperative and incoercible desire to urinate. Post-voiding drip, with urine flowing in drops after finishing urination. Since nocturia can be attributable to a variety of different causes and conditions, it is good to carefully investigate both the patient's functional status and all the information reported by him, as the anamnestic phase is, in this case, of fundamental importance. For the complete assessment of a suspected case of nocturia, the following steps should therefore be followed. During the urological examination, the urologist examines all the anamnestic information reported by the patient, with particular regard to the voluptuous habits that include the consumption of alcohol and caffeine, as well as sleep habits. It is also very important to evaluate how much waking up at night to urinate affects the patient's quality of life, trying to quantify the extent of the disorder and the worsening of sleep phases. Generally, after inquiring about the family history and the pathological anamnesis, the first phase of the visit is completed with the drug history, aimed at testing the type and quantity of drugs that are being taken during any therapies. The physical examination during the urological visit, if a possible picture of nocturia has emerged from the anamnestic phase, should focus on the following factors: examination of the abdomen and pelvic region, in order to assess pain and signs of bladder overdistension. A balance and vertigo test can also be performed to rule out any orthostatic hypotension. Or you can also perform a cardiac exam and lung exam to evaluate a possible fluid overload, as in congestive heart failure. The specialist may find it useful to use a voiding diary, thus keeping track of the amount of fluids ingested during the day, and noting all the times you urinate. Estimating the amount emitted, you can be an excellent way to better frame nocturia. The urologist can prescribe various laboratory tests aimed at better defining the patient's condition of nocturia. These include chemical physical examination of the urine and blood tests, including the glycemic structure, the renal function panel, the dosage of serum electrolytes, sometimes some instrumental examinations such as ultrasound of the lower abdomen and bladder, abdominal pelvic CT, and dynamic functional tests that assess the urinary flow and the state of the bladder and urethra may also be essential. If, on the other hand, it is believed that nocturia derives from a condition of diabetes insipidus, that is a condition in which there are low concentrations of antidiuretic hormone, a restriction of 8 to 12 hours is made from the consumption of liquids before sleeping. If during the first day after waking, the urine is not as concentrated as expected, then you have a possible ADH-dependent diabetes insipidus. The therapy for nocturia is based on 3 different types of approach to managing the problem, namely, initially, the urologist invites the patient to adopt initial preventive measures, such as limit the intake of liquids in the late afternoon and in the evening, reduce the intake of salt in the diet. It is also suggested to avoid long periods of immobility. On the contrary, it is important to carry out regular physical activity, even as a simple walk. Finally, it is helpful to limit drinks such as coffee and alcohol. The specialist may also consider the behavioral treatment useful and necessary, which involves muscle training of the pelvic floor through the execution of targeted exercises, through the Kegel technique, or trying to suppress the stimulus and delay urination. Finally, you can move on to drug therapy, which is mostly based on the following points: ongoing adjustment of therapy with diuretic drugs, such as hydrochlorothiazide or furosemide, administration of alpha-blocking drugs, to counteract male prostatic obstruction, and of anticholinergic drugs, such as oxybutynin, to promote bladder relaxation, antidiuretic hormone therapy with desmopressin, to combat diabetes insipidus and nocturnal polyuria. We are now at the end of today's video. We hope you enjoyed it. If you found it useful, please support us with a nice like and subscribe to the channel. See you soon on Med4Care.